Thank you, Dr. Reeves. Thank you, Pastor Young, and thanks everyone. And I'm really honored to be speaking here. I am part of the team run by Dr. Niharika Khanna, who's a professor in family medicine. As Dr. Reeves said, I'm a lung doctor and I'm an ICU doctor. So definitely I've been in the trenches during this COVID pandemic. And I have a lot of information, and I'm going to try to break down some of the real cluster slides for you so that you understand what is the situation right now. And I can talk to you about all of my anecdotal experiences working in the ICU, taking care of sick COVID patients. So this is our entire team, and Dr. Reeves is part of Dr. Khanna's team. But this was our first outing ever in the post-COVID pandemic. And this was just a few weeks back, we met outside. So just told, as Dr. Reeves said, personal care. That's what we did here. So how you're getting the information is something like this, right? Like this is a very nice effort done by Dr. Khanna's group, and they put out dashboards like this. But this is the kind of information that is coming to us. So what is so different about this pandemic versus any other pandemic or any other vaccines is the information coming to us is coming in this cluster form, so many different graphs. And it is so difficult for us to understand what do we concentrate on. So let me try to break it up a little bit for you. So I'm going to tell you a little bit about the vaccinations and what is happening to the vaccinations in the entire United States based on race and ethnicity. And it is whether you've received one dose or you've received both the doses. And you can clearly see that unfortunately, it is not the minority populations all the time who are getting the vaccines. Rather, this is happening more in the privileged population, and the patients and the people who are struggling, who are in the minority populations, are getting stuck with a lot of fake news. My favorite word during this entire time has been fake news. And we have been hit by fake news very, very badly. I know because I'm from India, and everybody has been hit by fake news. And that's why we saw one of the most horrid COVID surges there recently. But that's the same thing that's happening here. And I want you to only concentrate, look at this green line that tells you about the Black population. And that is the lowest rate of COVID vaccinations in the United States. So let us also concentrate on what is happening in the children, because earlier in the COVID pandemic, everyone was saying the children are not getting affected. This graph is basically talking about two childhood populations. The 0 to 4 is this light blue, and 5 to 18 is the dark blue. These are males, these are females, and this is in the state of Tennessee. These are the number of children, male children, who are getting affected, not only affected, dying of COVID. Dying of COVID. Children dying of COVID. You break it down then to the populations by race, and you see most of them are white, but the Black population is not that far behind. These are children dying of COVID. So let us be very clear on what's happening. The state of Tennessee put out their most recent profiling, where they talked about the number of cases, how much it has increased from the previous week. They talked about the number of deaths and how much that has increased per previous week. And look at the number of hospitalizations also. It is a lot. It is a lot. This is a very nice graph. I don't want you all to concentrate. It's very disturbing to look at the whole graph and the colors and everything. For those of you who are colorblind, I apologize. Here is the problem. Earlier in the pandemic, the people in red, that is 70 plus years, they were getting the most affected, okay? Now, what are we seeing? Now we are seeing less than 18, 18 to 39, and the 40 to 69. That is the group which has taken over. This is disturbing, especially look at the 18 to 39 and the less than 18 group. This is very disturbing. This is the state of Tennessee and the different cities. And this graph here tells you about the number of COVID cases. And as you can see, this is for the week of the 13th of August to the 19th of August. And the areas which had high 750 or more are in the darker colors, and Memphis falls in the 550 to 749. By the way, I did brush up on my geography of Tennessee before I started this talk because I was not familiar with the different counties and different cities where it was, having only visited parts of Tennessee. Here is also a map of the vaccinations by the different parts of Tennessee. And you can see Memphis is here, where you fall in the 40 to 49% population. So what you need to know is where you're vaccinated and where the cases are. And as you can see, the higher cases are not in the areas which have high vaccination. It's just the opposite. So the lower the vaccination rate, the higher the number of cases. I am trying to, again, so this is again the state of Tennessee reporting. They are talking about the number of people vaccinated, and this is by age, and this is by race. And you can see here that the number of children who are vaccinated between 16 to 20 is only 5%. And the adults between, young adults between 21 to 30 is only 11.7%. And same with the group of 12 to 15, it's 3.2%. In terms of the percentage of vaccination against the, again, the Black or the African-American population is lagging behind. This is a very good data. And why do we care? Because before the Delta variant, there were things which were different. This COVID pandemic is not stationary. It has not remained the same throughout the time. From the time I have started, you won't believe the number of papers that have come out on COVID, and every day there is new information on COVID. So this keeps on varying day by day, hour by hour sometimes. So this tells you, this is a graph which tells you that currently throughout the US, the Delta variant is here to stay, and it is the predominant variant. So what's happening in the state of Tennessee? So the Delta variant is this orange, darker orange, and red. The Delta variant is what is seen in region 4, which includes Tennessee, Alabama, Mississippi, etc. And you can see Delta variant is 98% of the cases. Why is this variant important? Because it spreads much faster, it causes much more serious illness, and it's affecting kids. This is a graph which tells you how much more disproportionately the 18 to 24 and the 12 to 17 are getting affected now. So I give you all kinds of bad news till now, but no, there is good news. Do you know the day the Pfizer vaccine was approved, within 3 days, we as doctors, as ICU doctors, were scrambling. We were calling people, we were putting our names on lists because we really wanted to get that vaccine. I got my vaccine on the first dose on 17th of December, 2020. And my God, I posted on Facebook, on Instagram, on every social media, and I'm not a usual social media person because it was the ray of sunshine in this devastating pandemic. So the good news is we have 3 vaccines which were authorized under emergency authorization use. But guess what? We have even better news. We have a vaccine that has been approved just 3 days ago for ages 15 and above. And this is exciting. This is so exciting. This shows modern medicine at its best, getting a vaccine out, getting it prepared, getting it through all this. This is the expertise of modern medicine. There are a lot of ingredients, and I don't want you all to sit down, and I'm not going to break down all this. I want to tell you the ingredients in these vaccines do not contain metal detectors, do not contain tracking devices, they don't contain aluminum, and they don't contain heavy metals. So let us be very clear in what goes inside these vaccines. It is not what the fake news would like us to believe. Vaccines are definitely effective for the Delta variant. They are effective in preventing symptomatic infection and 96% effective in preventing hospitalization. And this is for the Pfizer data. Are there breakthrough infections? There are. And that's why there is the booster shot, which is coming up. And I'm going to show it to you in the next few slides, because they have noticed with some of these mRNA vaccines that as you go 8 months beyond, you may need a booster shot. So that is again new data which has just come up. So everyone's talking about vaccines are killing you. Vaccines, you get a vaccine and you get your heart muscles turned to mush and you die. And this is the kind of news that is coming through. But you know what? It is not true. It is very rare. And when it occurred in less than 30 years old after the second dose within a few days. But hot off the press yesterday, we have data which was just published in New England Journal of Medicine, which as most of us know in the medical community, is one of the most prestigious journals to publish data. Now, this is the study conducted by Israel, because Israel did only Pfizer vaccine. They had a very clear rollout of the vaccine, and they looked at what happens in terms of all kinds of complications if you got the SARS-CoV-2 infection or you got COVID-19, that is in orange, or you got the vaccination, which is in blue. What are we seeing? We are seeing overwhelmingly that your kidneys fail if you get SARS-CoV-2 infection. You get heart irregular rhythms if you get SARS-CoV-2 infection. You get clots in your veins with SARS-CoV-2 infection. You get heart attack with SARS-CoV-2 infection. You get bad heart muscle involvement with SARS-CoV-2 infection. You get clots in your lung with SARS-CoV-2 infection. The only thing that was different was that you had enlarged lymph glands near the site of vaccination, and that was the only thing that happened with the vaccination. And if people have got diseases like mono and other things like croup, you will notice that you get enlarged lymph glands. So enlarged lymph glands just means that there is inflammation and the body senses it, and the body is revving up its immune response. With the Janssen vaccine, there was talk about the fact that your platelet count, which is your clotting cells in the body, come down and you get clots. But again, it is very rare. It is 7 per million, or if you're older than 50.9 per million. And again, the Guillain-Barré syndrome that they talk about, which basically means that certain people, after they get certain vaccines, and this has been talked about in other vaccines too, where they can get their muscles which become really weak, including their breathing muscles. That was 8 cases per million doses. And that has been shown to happen in other vaccines. What is happening with the post-COVID conditions? I've been reading up a lot of data on this, and I'm actually seeing a lot of these patients who are coming to my clinic. The problem is that even if you are not getting sick, like I had a 23-year-old who got an asymptomatic COVID infection, was just found to be positive with COVID, had no problems at that time, is coming to me 3 months later. She can barely climb up a flight of stairs. She says, I feel like I'm older than my grandmother. I'm not able to climb up stairs. I get short of breath when I move around. And her X-ray at the time of the COVID infection was normal. And now when I did the CAT scan, there is a lot of scarring. So this infection can cause a lot more problems than what we know. We have not seen the length and breadth of what happens after you get COVID, because it's such a new infection. We are in the history of a new disease. We will not know all about the disease till a long time. There was a recent published data on children who got very mild COVID. These are teenagers who were in school. And guess what? They are not able to concentrate. They cannot remember things. They have brain fog. And several of my patients who I've seen in clinic have complained the same thing. So this is not about dying of COVID, getting lung injury with COVID. Even if you just get a mild infection or turn positive with COVID, these things can happen. So this is pretty scary, because there is just data that came out today that 3.6% of patients who ever were positive with COVID are going to have a lot of shortness of breath, and we don't know how long it's going to remain, but it has remained at least for 8 months. So how do we combat this, right? We need high vaccination. We need low community spread. The low community spread can only occur with social distancing, wearing masks, and trying to get the vaccine. And all this together is what is going to help us come out of this pandemic, come out to some kind of normalcy where we can meet each other again instead of talking to each other virtually like this. The HHS just came out with the guidance that they are going to offer booster shots for all Americans beginning week of September 20th and starting 8 months after the person's second dose. And these are for people who got either the Pfizer vaccine or the Moderna vaccine. Mine is going to be due next month, and I'm so waiting for it.
But if they want to do it the private, like the family thing.
Last but the least, you know, we doctors, we really want to help. Call your local doctor, call your family doctor, call the person who you are comfortable with. Go and see them, go and talk to them. Please don't believe the tweets you're seeing, the fake news you're seeing. Anybody can Photoshop anything. You won't believe that University of Maryland was Photoshopped as University of Facebook. And similarly, something similar like that happened in WhatsApp, where University of WhatsApp was under University of Maryland logo. So people do strange things in today's social media. And unfortunately, go to your doctors. We went to school for this. Go to your pharmacists, go to your nurses, go to all the healthcare workers who are seeing this, who know about it. Go to your pastors who are learning about it and who are helping you. Go to them. Please don't rely on the fake news. And that's all I got.